Good evening, everyone. I welcome you all to Nigeria. My name is Dr. Sekinat Folorensho. I'm the AI ambassador for Nigeria and your anchor for tonight. And I'm AI and ML lecturer from Oladipo University, Awokoya. I welcome all members of Why Nigeria and Why Global in general. And I welcome all attendees all over the world and those who can make it. Now, please visit our Women in AI booths, register to become a member. Our theme tonight is on social impact on women, like women overcoming the challenges when they pursue AI as a career. Some leave their dream unachieved, some are unfulfilled. So some of our speakers are, okay, for tonight, for this session, I have Professor Francisca talking on fair data, science of fair data. Professor Francisca is a professor of computing, and she's a director, research and innovations at international relations at Kampala International University, Uganda. And she's also a lecturer at Islamic University, Uganda. So as part of this COVID-19 response efforts to worldwide data science researcher, she's the executive coordinator of the Virus Outbreak Data Africa Network. That's VODAN Africa, covering countries like Uganda, Kenya. Now, Professor Francisca, you have the floor now.
Yes, I'm with you. Good evening and welcome to our session. And it's an exciting day. It's been a long day. We've been here for hours now, and it's been so exciting listening to all the inspiring talks from everyone in this session. I'll be speaking on the science of fair data, like Dr. Sekinat had already introduced me, so I'm not going to go about talking about me. It's not about me today, but there is one very interesting fact about me. I kind of refer to myself as an immigrant software engineer researcher. Actually, out of my 20 years career in the academia, I had 17 of software engineer. I emigrated to artificial intelligence research. And I've also spent 16 years of my 20 years in teaching, and now I'm fully involved in administration. I was moving to like, I'm going into administration. What's it going to be like? Am I going to really be missing, like teaching, supervision, and all that? But the science of fair data has been one avenue for me to actually administer artificial intelligence and data science, even as an administrator. Yeah, so this time last year, we're all excited. Yes, we're waiting for 2020. It's a new year, the millennium, and all that. And then the crisis of COVID-19 happened, and it started from China and started moving to different parts of the world. And before you know it, we had all the fears, we had the disruptions, and it threw up so many things. But we're not all negatives. We also had positives and opportunities. And one of the opportunities and the positive is the convergence of different kinds of science. So the COVID-19 brought about different kinds of science working together and contributing to combating the pandemic. So we have the natural or biosciences, which involves medicine, people involved in testing, in looking for vaccines, in managing the diseases, through managing the symptoms for treatment and all that. And then we have those in communication from the social sciences, trying to combat misinformation, trying to provide information, provide training. This is how to wash your hands for how many seconds. This is how to put on your face mask. This is how to wear gloves, and so on. And then we have the sciences that provide support and counseling. Many people have been affected by the pandemic in one way or the other. People have lost loved ones. People have lost their jobs. Kids are out of school. Students have not been back to school in the normal setting. And then they provide some kind of social support as well. And then there is our own kind of science, data science. And it came that realization that from this crisis, that machine learning and artificial intelligence is actually very relevant in the scheme of things. And it's going to go beyond diagnosis, trying to track the finding of vaccines and testing and all of that. But actually, there's going to be a very specific role, a very special role, that we have scientists in the field, we have researchers who are trying to find vaccines, who are trying to understand how the virus has evolved in mankind, the various devastating effects in different parts of the world. There was this recent study by the BBC wondering how come there is they were actually expected so much death from Africa, but now very few deaths, and it's actually affected the developed world, the West, more than actually the global South. And we now realize beyond all this, data is very critical. Data that could be found, that could be accessed in the right format, that could be interoperable across several platforms, and could be reusable. Fair is very, very important in the fight against the COVID-19. And then this different kind of science, another way of doing data science also came up. And you can ask questions like, how do we provide access to critical data across locations? Different kind of symptoms have been observed in many places. How do we help scientists? How do we help researchers who are trying to research on vaccines to be able to see the different facets of the COVID-19? How do we ensure that whatever data they have access to is official, it's coming from official quarters? And then how do we ensure that data that is collected under any jurisdiction remains under the governance of that jurisdiction and it is owned and protected as their personal data? Such as in Africa, most times when we need to have access to data sets, data that are collected now and reusable. And beyond the COVID-19, there's going to continue to be data generated in Africa, in different parts of the world. How do we ensure that interoperability? How do we prepare the world for future outbreaks? We are hoping that this pandemic will eventually be over, or we learn to live with it, and somewhere down the line, some new pandemic comes. What lessons? Many of the lessons of the Ebola epidemic were not carried over into the COVID-19 pandemic. So how do we ensure that that does not happen? To answer all these questions is the exciting new computing area. It's not completely new, but now it's coming to Africa, and Africa is coming to that realization that beyond having our graduate students in Europe, we also need to bring the science of fair data into our own research space. So the critical points for Africa, the idea of data is so much of a Western thing. We actually use data sets that have been collected, even some from Africa, but they're stored somewhere in the West. And then, how can we ensure that Africa becomes a huge resource of verified data? Millions have been affected by the pandemic. Several researchers have published on COVID-19. When we look at repository of available materials and publications on COVID-19, very minute percentage of that are from Africa. Could we find a way of aggregating all this data, patients' data, research data, publication data, every kind of data, and then expose them in the right format to the entire world? And the data becomes resident in Africa, and it is owned by Africa. They are not removed and stored elsewhere. Then we also look at another critical point. We need to strengthen data-informed health system for Africa and the world. There could be some very rare cases, rare occurrence of some symptoms in certain patients in Africa. How do we ensure that researchers in Indonesia who are probably, or Russia, are working on vaccines, take account of such special symptom in Africa? They wouldn't know. It probably happened in one village in Idore, deep in the woods of Ondo State. How do we ensure that this information becomes available? And the availability is there, but it is owned by the government of that country, and every privacy law of that country is obeyed in accessing that data. How do we build capacity along this line? It is not just enough to have the researchers, to have the fair data points built, but how do we ensure continuity, that subsequent need for data is stored in the right format and distributed to the rest of the world in an accessible format? And it brought about the birth of VODAN Africa. VODAN Africa stands for the Virus Data Africa Network. It wasn't about COVID-19 per se. We're looking at virus outbreak generally. But the significance of VODAN Africa to today's event, the first thing is the fact that it is a women-led AI and data science community. So in the core team, we have the global coordinator, Professor Miriam Van Reysen from Leiden University. I am the executive coordinator. The technical coordinator is Miriam Basaja, another female. So at the top level organization of VODAN Africa are 3 women. And of course, within the country cohorts, we have 3 female leads. For Nigeria, Dr. Sakinat, Tunisia, Morgan Reed, and Professor Mariam. And of course, we have data stewards and data stewardship group that are led by female. And we also have a technical support team made up of 2 female grad students. So it's an example of a female-led artificial intelligence and data science community that has really been successful in ensuring that data in Africa are findable, are accessible, are interoperable, and reusable. And another important point about this women-led initiative is the concept of making sure that Africa is included in the fight against the COVID-19 pandemic through artificial intelligence. And there is something significant that happened on 22nd of July. The very first COVID-19 fair data point was installed in Africa. The very first worldwide was installed in Africa, actually installed in Uganda at Kampala International University. So a women in artificial intelligence-led initiative has led to making that history of installing the very first COVID-19 fair data point. The first one globally was installed in Africa. And this initiative is also building capacity, bringing together graduate students from 6 African countries and 2 key universities in Europe to build capacity in fair data stewardship, so that at the end of the day, this women-led group can offer FAIR as a service to hospitals, to ministries of health, to research institutions across Africa and actually beyond Africa. The funding for the VODAN Africa initiative is provided by the Philips Foundation, the FMO, which is a Dutch development bank, and then recently Google through the Google University Relations. And there are partner universities and ministries of health in Uganda, the east of Africa, Ethiopia and Kenya. And then moving to the west of Africa, we have partner universities in Nigeria. And moving to the north of Africa, we have partner university in Tunisia. And down to the south, we have Zimbabwe. And in Europe, Netherlands and Belgium. And in the rest of the world, we have the San Diego Supercomputing Center and then the Stanford Metadata Center as part of the partnership. VODAN Africa is building a network of fair data points in the 6 African countries. And so far, the 6 countries have been covered and it's now ready to link with the rest of the world. Last week, the Leiden University Medical Center installed the first Europe fair data point on COVID-19. And VODAN Africa is linking Africa, the artificial intelligence community, and the COVID-19 fair data is being linked to the Leiden University Medical Center. FAIR stands for Findable, Accessible, Interoperable, and Reusable Data. And in the concept of FAIR, it simply involves how research data, how data outputs could be stored and organized in such a way that it can be easily accessed, it can be understood, it can be exchanged and reused. And it is not the default for most funding bodies in Europe especially. It ensures integrity and also causes openness by default. So irrespective of the original format of the data, it is interoperable across different platforms. It can be reused over and over again because it remains resident where it is collected. The algorithm will visit the data in residence, perform the analysis, and leave the original data unchanged while publishing the result of the analysis. the data has to be stored in a way that it is findable. It is no longer hidden somewhere in textbooks or in storage drives in university libraries. No, it is actually shared, and then access paths will be provided in the storage. The concept of findability. Each data under the FAIR principle will be defined in rich metadata. And then where in some fields where metadata do not exist, the metadata will have to be created, will have to be defined, where the data is collected, who is the political ownership, what kind of language, what kind of data storage type, or what kind of data. Is it misinformation on COVID-19, for example, or a curated list of publications in universities and research institutes in Africa on COVID-19, or on some other kind of subject. So for VODAN Africa, there are 4 findability definitions of findability paths to make sure that each data and metadata has a unique global identifier. I'm going to be showing some of the FAIR data. I'm going to be showing some of the FAIR data points on the COVID-19 under the VODAN Africa. And then there is the accessibility to make sure that data is open and accessible, and the accessible part is specified. If for some reason, like patient data for privacy concerns, the accessibility is not directly possible, how the data can be obtained will have to be specified. And then the data is interoperable across different platforms, and it is reusable generally over and over again. So this has resulted in a 3-way verification framework to define the metadata for the data, and then to define the FAIR implementation profile, and finally build a FAIR data point. So in the context of COVID-19, we have the FAIR data point index across the different countries. We have for Nigeria, Ethiopia, and so on. That's the URL to access the FAIR data point. And this is the AAU FAIR data point in Addis Ababa, University FAIR data point in Ethiopia. This is University of Sousse in Tunisia. You see the uniformity in the definition. This is Data Science Nigeria FAIR data point. And every other FAIR data point would have this same cataloging system. So once you've seen one, you've understood one, you actually understood every other one. So I'm going to conclude by saying, yes, we've had this crisis of COVID-19. It has disrupted our lives and all that. But we also have an opportunity to realize something, that the science of data is as important as the science of medicine. So as new treatment options are being examined, there is a need to provide the right kind of data that will help in those research. So it is important to find vaccines. It is also important to make sure that the data that is needed for the healthcare providers to actually work towards getting a vaccine, getting a management routine for this healthcare pandemic, it's also available in the right form. And FAIR data has put computing right in the center of the fight against the COVID-19 pandemic. Yeah, thank you very much. To see sample FAIR data points, this is the homepage of the FDP index for the VODAN Africa FAIR data points, and the other FAIR data points in the San Diego Center and Leiden University Medical Center. Thank you.